animal products in your diet, then you need to take pills, all right? If you don't have another condition, the reason the stomach is up there is your stomach produces a chemical, this is what I had to have Dr. Juan help me with, identified as intrinsic factor. And the intrinsic factor is required for the absorption of vitamin B12. If your body is not making intrinsic factor, then even if you have vitamin B12 in your diet, the body can't absorb it, and pills will not work. All right, so the only way to take it is vitamin B12 injections.
Wait, what does intrinsic factor do?
It helps in the absorption of vitamin B12. So if you eat vitamin B12, it won't be absorbed into the body for use without the intrinsic factor. So you can have a normal stomach, but if you decide to have gastric bypass surgery and they lop off 3/4 of your stomach, there goes the cells that make intrinsic factor. So the lap band, where they just narrow the diameter, is much better as far as providing your body with sources of intrinsic factor.
Are all vitamin B's water soluble, like the liver?
They're absorbed across the intestinal tract. I don't know about what those.
Biotin is water soluble, like you can't
Yeah.
take too much of it, but I didn't know.
The fat soluble vitamins are A, B, C, and K.
And those ones actually go to your liver, you can overdose.
Right. Right. So people will take pills or they'll go and get injections of vitamin B12. This has nothing to do with red blood cells, but it's just interesting. I like murder mysteries and forensics kind of stuff, and this always reminds me of a story, true story, where there's this woman. She was married. She was dating a doctor to whom she was not married, but he was also married. And she thought they were in love. She was, and they discussed, well, if we each get divorced, then we can marry and be together. And so she followed through on it. She got divorced, she had 2 kids, she divorced, was a single mom. Her boyfriend never got divorced. So over time, she realized that this was not going to be the way that she wanted to live her life, and she tried to pull away, and he wouldn't let her. He kept coming after her. She finally met a guy, started dating him, and realized he asked her to marry him. And she told her doctor friend that, okay, this is it, this is final, I'm moving on, this is not going to be. And who knows what happens in relationships. He called her up that night or a night or 2 later and said, I'm going to come over and give you an injection of vitamin B12. And apparently he had done this in the past. But why you would let somebody into your house at 1 o'clock in the morning, wake you up, anyway, that's what happened. He came over, gave her an injection of vitamin B12. 6 months later, she developed AIDS. And she was sure that that was his reason for coming over, and the blood, what he injected her with, had blood that had the AIDS virus instead of the vitamin B12. So she went to the local police office, and at first we don't believe you, this guy's a good citizen, we've never had any complaints against him, this is just conjecture, we don't want to disturb, go after him and accuse him of this. And she was so persistent. She had said, I have no other risk factors, I've never had a transfusion, I don't work with individuals whose blood I might come in contact with, I don't work in a hospital, I don't come in contact with any body fluids, I don't have any risk factors in my life. She said, this is the only source that I know of. And so finally, the sheriff, bless his heart, got a search warrant and went to the doctor's office, clinic, and found in the refrigerator of the lab, I don't know if it was his own clinic or wherever, but a patient, blood from a patient that he had seen the day that he went over to her house. And they sent it off for testing, and they were able to ID the strain of the virus by following its genetic mapping and map it to hers. And HIV viruses mutate so often that they have unique strains, and it matched the one that she had in her body. And not only that, but the guy whose blood he had used also had hepatitis, and so did she. And so they charged him with attempted murder. She ended up dying about 10 years later from AIDS, and they had already been convicted of the attempted murder, and charged him again with murder. And it's the first time that they've used a specific viral strain as a forensic marking to prove the relationship between events. Like I said, it has nothing really to do with vitamin B12, but it was just an interesting microbiology kind of event in there. I don't know.
That's just.
But, all right, sickle cell anemia is the last of the anemias that we'll talk about. And sickle cell anemia is a genetic disorder in which there is a single amino acid substitution between glutamate and glutamic acid and valine. And that single amino acid substitution changes that bioengineering effect and the stability in the membranes for the shape of the red blood cell, but only in low oxygen. So in an oxygen crisis, when the oxygen tension content of the blood drops, and it varies on what that level is, the cells sickle in shape, and the individual goes into sickle cell crisis, and these cells collapse and become sticky and can block small, tiny arterioles and capillaries. It causes joint pain. It can cause tissue damage, organ dysfunction because of the loss of oxygen transport to those tissues. This is found primarily in African Americans or people of African American descent because that was where the genetic mutation originally occurred. Interestingly enough, it is a protection for malaria. So individuals who have sickle cell anemia, the parasite will not cycle through their red blood cells. It cannot grow its stage within the sickle cell red blood cell. So it provides a protection against that particular disease.
That's with
Against
low
malaria.
oxygen?
So the sickling occurs when the oxygen content of the blood drops. Yes,
That won't happen in just a carrier, right? They have to
Right.
have some.
that's a recessive. So you can see here some of the sickling that's occurring. These little structures here are platelets. We'll talk about those tomorrow. The oxygen, no, not the hemoglobin, but the oxygen tension is the amount of oxygen that's dissolved in the blood, fluid of the blood. So that's an oxygen pressure. Oxygen saturation is a percent saturation of hemoglobin. The two are related. We'll cover that when we get to the respiratory system. So in other words, oxygen is 20% of air. Oxygen is 20% of air, which leads to a partial pressure, and this is for 3 right now, a partial pressure of 160 millimeters of mercury. In your alveoli, that's diluted out, becomes about 104. So typically, arterial blood is going to have an oxygen tension of 100 to 104 millimeters of mercury. In the tissues, that drops down to 40 as the oxygen is delivered to the tissues. So it has to do with the gas pressure of the oxygen dissolved among the fluid molecules. The higher that is, the more will bind to oxygen, the hemoglobin, the more will bind to hemoglobin. So the oxygen tension and saturation are directly related. All right, I wanted to, before we take a break, I wanted to just go over a couple of blood tests. I'm sorry, Rachel.
Okay. So when a vessel splits, it blocks blood.
Well, it doesn't split, it collapses.
Oh, collapses.
So the sickle cell shape is due to the loss of those cytoskeletal structure integrity. So it's not ruptured, it's collapsed in on
Nope,
itself.
that picture down there, the left
Yeah,
one.
so here, these
Yeah.
are, each one of these is a sickle cell.
Yeah.
And it's stuck, it's blocking, they stick to each other and they block they block blood vessels. But they don't split, they don't rupture, they just collapse.
The points that kind of stab in.
Yeah.
Does it fold?
It folds into itself?
Oh.
Yeah. All right, so we already talked about hematocrit. So hematocrit is measured by percent. That's what I went through at the very beginning of lecture. the approximate range, when we do lab, I'll give you a more specific one, but the approximate range of hematocrit for males is about 46 to 52, and females is about 38 to 42. I think I might as well give you the complete. I gave a standard one. It differs from lab to lab, and I gave the lab a standard one this morning to use for their okay, 36 to 46, 41 to 53. What I gave the morning class was slightly different, but you can use what I have on the board when you're translating your lab values. All right, so then we have hemoglobin. Which I don't have on there, so let me write that on the board and then we'll look at this one. So hemoglobin is a measurement of the amount of protein, and it's given in grams. So males are approximately 16 to 18 grams. Per deciliter, and females 12 to 14. And when we used to run body fluid tests, hemoglobin was real wet and dirty. We would have these charts that had varying shades of red, starting with orange and going to a really deep red. And they would have a hole cut out the middle of them. And you would poke your finger, put the blood on a piece of blotting paper, a little thick paper towel, and then slide it under this back and forth. So the back of it had all these blood streaks from other people. And until the color matched. And it was just a pure color matching. So the orange blood was the lower hemoglobin, the deeper, darker blood was the higher hemoglobin. They also have hemoglobin cytometers, which use light waves bouncing off of the cells to measure the amount of hemoglobin. Okay? And then this test, you'll be looking at each of these in the PhysioX blood test. ESR stands for erythrocyte sedimentation rate. And when I used to try to go to give blood, I would see these on the table. It kind of gave them I don't know what, I didn't really call them a hemoglobin. But anyway, they'll take your blood and put it in a tube mixed with a fluid and then watch how long it takes for it to clear. All right, how long it takes for it to settle. And it's measured over minutes to an hour. And what happens is, under certain disease conditions or factors, the red blood cells stick to each other and start to stack up like a stack of coins, and that's called a rouleau. And the more that happens, of course, the faster it's going to sink because the whole structure is heavier. All right? So you can see a little bit of rouleau forming here. So those factors increase if you're a woman, by age, by gender, by race, and by disease. And it's a factor affected by the charges on the blood cells. And so it's very, how should I put it? It's very nonspecific. It doesn't tell you a whole lot. It just says, okay, it's quick to do, and it tells you here's something you might need to go look at some causes. All right? So if you have a really high ESR, normal is around 15 to 20, 25 millimeters an hour. It says take your age times 10 if you're female, and then divide by 2. All right, so if you're 30, it should be 15 millimeters an hour. So very high, greater than 100 is much, it's almost 5 times higher than average. And so some disorders that will cause it, I don't have heart attack up here, but it's inflammatory. Most of these are inflammatory type of diseases, and that increases the factors that cause the sticking together, okay? Or if it's a very low ESR, then that's something else to look at, but usually the most common effect is a very high ESR, erythrocyte sedimentation rate. So I just want you to be able to know the normal values for hematocrit and hemoglobin. We'll look at some causes in just a moment. Recognize the equipment that's being used. So if you see a row of tubes, and you'll see this after lab, after the you'll actually recognize it, or the centrifuge for the hematocrit, or that strip of color circles for the hemoglobin. So what are some causes then? So we've looked at causes of anemia. Let's finish up here with causes of polycythemia. So we have the intrinsic factor loss, the lack of iron, low protein in the diet, whatever. What are some causes for polycythemia or too many red blood cells? Okay, similar to what we talked about with our viscosity, because this is going to cause a higher viscosity. So blood doping. What's another cause of increase in red blood cells?
Dehydration.
Dehydral, that's a loss of fluid, but what's going to cause blood cells to go up? Blood cell formation. So our ratio is determined by the volume of fluid we have to the volume of cells. So we can increase our hematocrit by increasing our cells, or we can increase our hematocrit by decreasing the fluid. So dehydration is going to decrease our fluid. What's something else that would? Well, diuretics, yes. But what's something that could increase the cell count, the actual cell numbers, cell production at the bone marrow? I haven't drawn my husband's blood, but he should, even though he's a male and already had a higher red blood cell count than I did. What other reason does he have?
Testosterone?
Yeah, for being a male. Some of you know where he lives.
Oh, altitude.
Higher elevation. We moved to Denver last May. So at higher elevation, the low oxygen tension triggers the kidneys to produce a hormone known as erythropoietin, and this body makes more
During elevation change?
higher elevation. In fact, they say, so when the Olympics were at in Mexico City, the athletes went there early to adapt, and adaptation is not just the physiology of the blood vessels and the heart, but triggers an increase in red blood cell synthesis and hematopoiesis. In fact, the dogma for training is to train low and sleep high. So you would train here in Sacramento Valley, ride your bike, and then go up and spend the night up at 7,000 or 8,000 feet to get this effect. And then train at the lower elevation and gradually build up your intensity as you build up your increase of blood cells. Now I have another student who has polycythemia, and the treatment, they don't know the cause. There is a leukemia, which is really white blood cell increase, but it can push out red blood cells before they're mature. So you have an increase of immature red blood cells that are crowded out of the bone marrow. Hers, they don't know a cause, and her treatment is she goes in and gets her blood drawn every 4 to 6 weeks. And they take out, spin it down, throw away the blood cells, and give her back the fluid volume.
Why wouldn't the filtration have the higher?
Probably just for the stress of the heart. And then you get the cortisol release and all of that. So you sleep at the higher altitude and then use that extra oxygen to increase your training and muscle use at the lower level. All right, let's stop and take a break. I said we were going to do that 15 minutes ago. So come back at 1.